Let's delve deep into the issues. We'll take you beneath the surface.
Greetings and salutations. My name is Orville Higgins and it's another edition of Fan Central.
Talking to the people at the heart of the top sporting stories. Hear from your favorite sportsmen and women and the administrators who work tirelessly to make it all happen. It's live sports talk.
I've written an entire article.
Yes.
Looking at all the major issues every Tuesday at 9 p.m. It's Fan Central.
Thanks for joining us for CVM News at Noon for this Wednesday, May 27, 2026. I'm Amoy Harriet. Up first this afternoon, Prime Minister Dr. Andrew Holness today announced the appointment of Ambassador Major General Anthony Anderson as Chief Executive Officer of the National Reconstruction and Resilience Authority, NARA. Anderson currently serves as the country's ambassador to the United States. Now, the announcement was made at a special post-cabinet press briefing Wednesday morning. Ambassador Anderson will assume duties on June 1. Now, Major General Anderson, according to the Prime Minister, brings experience in public administration, national security, disaster management, institutional leadership, and crisis response. He also recently chaired Jamaica's post-Hurricane Beryl Disaster Risk Management Review Committee, which examined lessons from the national response and made recommendations to strengthen Jamaica's disaster preparedness and resilience systems. The Prime Minister said the appointment comes at a critical stage in Jamaica's post-Hurricane Melissa recovery and reconstruction program as the government moves to accelerate implementation while maintaining strong systems of accountability, transparency, and fiscal discipline.
He would obviously have great skills in leading national institutions. He led two of the most important institutions in Jamaica, the JDF and the JCF. In both instances, he would have designed and implemented transformational programs in both institutions.
The government is moving to strengthen Jamaica's disaster preparedness system with a renewed focus on making the Office of Disaster Preparedness and Emergency Management, ODPEM, more effective in crisis response and coordination. Speaking at the launch of the National Risk Disaster Council on Wednesday, Prime Minister Dr. Andrew Holness says the agency must evolve into a stronger national resilience body.
ODPEM, by law, must be a national bastion of leadership in crisis. Steps have already been taken to strengthen ODPEM, including its organizational review, new hires, upgraded posts, staff welfare measures, and planned training. ODPEM is an absolutely important institution, but for many years, not having been tested, it has become inward-looking and essentially existing for existing sake. And the organization needs real intervention.
The People's National Party has welcomed the announcement by the Prime Minister that the Western Children and Adolescent Hospital in Montego Bay, St. James will be named in honor of former Prime Minister Portia Simpson Miller. The announcement came shortly after opposition leader Mark Golding, in remarks delivered during the rededication ceremony for a Ministry of Labour building named in honor of Mrs. Simpson Miller, called for the Children's Hospital in the parish to also bear her name. Speaking at the ceremony, Golding said the hospital was deeply connected to Simpson Miller's legacy of service and national development. In a press release sent on Tuesday, Golding noted that the hospital was Mrs. Miller's brainchild and she made the necessary interventions with the Chinese government to secure financial support for the project. The PNP says the naming of the institution is an important act of national recognition and a tribute to a leader whose commitment to uplifting ordinary Jamaicans continues to leave a lasting impact across the country. Jamaica's health system continues to face pressure from staff shortages and the migration of medical professionals. That's according to opposition spokesman on health, Dr. Alfred Dawes. Speaking Tuesday on CVM's lead story, Dr. Dawes said developing countries like Jamaica are struggling to compete with overseas recruitment offers targeting nurses and doctors.
It's a challenge that is faced by many developing countries, even in Africa, although we're looking at recruiting from Ghana. There are some articles coming out now speaking about the exploitation of Africa, whereby persons are being offered the best trained, the doctors and nurses, they're being offered the lucrative jobs in the first world countries that the developing nations, they just can't seem to compete with. We are in that trap as well.
Meanwhile, also on Lead Story Tuesday, Minister of Labour and Social Security Colonel Charles Jr. said Jamaica's labour laws must continue to evolve to keep pace with a changing workforce, including platform and gig economy jobs. He says the government is working to make labour legislation more practical and accessible while strengthening protections for workers.
We've been trying to take pieces, bits and pieces of the law and break it down to make it more practical, more relatable, so people understand how this law provides for you a pathway to justice, how this law provides a guideline for you to provide decent work, and how we're going to continue to evolve and strengthen the law so that the future of work in Jamaica is one that we continue to be competitive.
Now, residents in Stepney St. Anne are expected to benefit from improved access to potable water following Friday's groundbreaking ceremony for a new rainwater catchment tank in the community. The project forms part of the government's wider push to strengthen water infrastructure and climate resilience in rural Jamaica. More details in this report.
In St. Anne are set to benefit from a new 180,000-gallon water catchment tank under a $140 million government project. Construction is scheduled to begin June 1 and is expected to take approximately 6 months. Speaking at the groundbreaking ceremony, Water Minister Matthew Samuda says the investment reflects the government's commitment to improving lives in rural communities.
We have a long way to go, ladies and gentlemen. But I think the time has passed for the quote that says, if you want to go fast, go alone. And if you want to go far, go together. Well, it is time that we dispense with that quote and we go far very fast. Because Jamaicans have waited a little too long for us to turn the corner with our financial affairs, and we have. There are still risks, we're still fragile, but we have turned the corner in our management of our fiscal affairs. It is time now for us citizens to see the dividend of that. In the water sector, we have already had to spend $3.2 billion on recovery efforts. That's spent. There is no illusion that we have had to invest very heavily. Your government put itself in a position to have some financial buffers, and thankfully we've been able to invest what was needed.
Minister Samuda says the project will also reduce the need to truck water in the community, freeing up resources for other priorities.
Ladies and gentlemen, rural Jamaica, I think many times I've felt left out of the investments that they see. So when they see Grand Airport expansion in Montego Bay and massive roads being built in Kingston and high-rises at massive hospitals in Spanish Town and in Clarendon being instructed, they say, where is my piece of the pie? That task force that we announced earlier for St. Anne will do a lot more on the water in this parish.
He also points to the importance of strengthening Jamaica's resilience as the country prepares for increasingly dry and hot conditions.
NARA will allow us to deploy capital within 12 months on such a project. You see, Jamaica faces what you call multiple hazards. Right now, we are expecting very dry, very hot conditions throughout the next 3 months. And you're going to go from the traumatic memory of a rain event and a wind event in Hurricane Melissa to the traumatic event, certainly traumatic for myself and Xavier, when we have to go find the money to truck water. When Mrs. Cunningham has to say, Lord, she don't have it because of the dry season that is upon us.
Natasha Williams, CVM News.
6 units at the Denham Town Golden Age home are now in better condition following a Labor Day improvement project led by the Ministry of Local Government. The initiative brought together government agencies, the private sector and the JDF in support of the facility's residents. Akeem Oret has more.
The Ministry of Local Government on Monday carried out work at the Denham Town Golden Age home on Labor Day. The project entailed upgrades to 6 units that were in need of repairs. Acting Inspector for the KCMC, Donaghy Brady, says the team carried out a number of initiatives on the day.
We have taken on a renovation task, basically, and what that task entails is the renovation of 6 of our cottages. The grounds, we are going to modernize the grounds in that we're laying decorative blocks, which are environmentally friendly, and we're doing some painting, minor plumbing works, and fixing some faucets.
Local Government Minister Desmond McKenzie thanked the EdgeChem team and the JDF for their involvement in making the project a success.
But in terms of the number of individuals that have come out today supporting the efforts. And they came well in advance because they came to look at what colour schemes would be practical to be used. And so we are seeing the benefits of the involvement with EdgeChem. Also want to thank the JDF, who's also has been a critical partner with us here in Denham Town, because Denham Town is a part of the Zozo, and they have been working with us, not just on Labor Day, but throughout every occasion that there needs to be something.
Managing Director of EdgeChem, Doreen Frankson, commended the minister on the partnership while sharing enthusiasm to future partnerships.
And I appreciate his support and his work that he has done. And we are very happy to partner here today. This is the kind of thing that makes us stick at EdgeChem, looking after our people, our aged people. So this will not be the only thing that we will partner with. We will go along as we can and help as much as we can.
Akeem Oret, CVM News.
It's time now for a break, but stay with us. Our live interview when we come back.
Let's delve deep into the issues. We'll take you beneath the surface.
Greetings and salutations. My name is Orville Higgins, and it's another edition of Fan Central.
Talking to the people at the heart of the top sporting stories. Hear from your favorite sportsmen and women and the administrators who work tirelessly to make it all happen. It's live sports talk.
I've written an entire article.
Yes.
Looking at all the major issues every Tuesday at 9 p.m. It's Fan Central.
back to CVM News at Noon. Now, the Ministry of Health and Wellness is urging Jamaicans to reconsider any plans to travel to countries affected by the Ebola outbreak. The advisory follows the World Health Organization's declaration of the outbreak in the Democratic Republic of Congo and Uganda as a public health emergency of international concern. Now, the ministry is also encouraging members of the public to rely on official and authorized sources for accurate information regarding the outbreak. Now, joining us to discuss the matter further is Dr. Nicole Dawkins-Wright, who is the Director of Emergency Disaster Management and Special Services at the Ministry. Good afternoon, Dr. Dawkins-Wright.
Good afternoon to you and to our listeners on the platform as well. Good morning, afternoon, sorry.
Thanks so much for joining us. Talk to us. How concerned should Jamaicans be about this Ebola outbreak?
Okay. So we are going to say that, Ebola disease as in and of itself is a pretty severe condition, rare, sometimes fatal. However, this is a condition at this time that the WHO has indicated that for countries like Jamaica, we are currently at relatively low risk. But there is a threat in relation to the international travel of persons who may be affected by Ebola.
So why is the ministry urging people to reconsider travel plans at this time?
At this time, for persons who may be exposed to persons who may be ill with Ebola disease, they can become exposed and contract the virus and bear symptoms for as long as 21 days before manifesting any signs of the disease, and therefore be a source of introduction of the disease into the country if they are coming from areas that have been affected by the outbreak.
So what happens if someone travels from an affected country to Jamaica? What exactly are the measures in place at our ports of entry?
At this time, what we have done is enhance our public health surveillance system at our official points of entry. Now, these would mainly be our international airports and, of course, our cruise ports where we have our cruise liners that coming in. As part of our normal procedures, persons coming in from anywhere would undergo a general assessment in terms of the travel history that they are given, and we ascertain from persons their history within the last 6 weeks. And certainly when it comes to Ebola, it would be countries that have been affected within the last 21 days. So we get that information before you even board a flight to come into Jamaica. So as soon as you come in, of course, the public health team, the port health team at our points of entry would have had that information ahead of time. In addition to that, for persons who come in who may not even realize it, there is a general scanning that's done in terms of our temperatures to see if you might be having the early signs of symptoms suggesting Ebola disease, and we would identify you and pull you out as well at the point of entry. At this time, however, we have also indicated to our port health team that if persons are coming from any of these affected countries, having transited or traveled in those countries within the last 21 days, we will identify those persons and, of course, to quarantine while we monitor the health department.
When you say quarantine, for how long and why?
So at this time, we'll monitor for persons, ask for quarantine at your home for 21 days from the likely time of exposure. So for example, if you leave the country today, it will be for 21 days. If you land in the country and it was a few more days before that, it will be number of days up until the 21 days, counting from when you last left any of the affected countries.
What about
And so there will be a public health officer who would liaise with the persons who have come in and do a check on their health symptoms or signs for that period of time.
What about tourists, though? Because you said quarantine at these individuals' homes. What about tourists who they're probably coming and they're planning to stay at a hotel? Is it that they will be quarantined at whatever address or destination they're heading to, whatever hotel that is?
Absolutely. So we will in fact have measures in place to identify persons who will need closer monitoring in terms of their health system for their period at whichever location that they would be accommodated.
What symptoms would make a person be a suspected Ebola case? Could it be because, people will come in, then probably have a little flu, then probably have a little sniffle? How would you be able to identify, yes, this person might have Ebola when they enter the island?
Well, the main thing in terms of assessment of risk was really a travel history. So for persons who may have entered those affected countries, because the truth is the symptoms are very common, look like common conditions that we're familiar with. Your flu-like illness, for example, fever, general aches and pains, vomiting and diarrhea. So it's not specific. Hence, the most important aspect is that history of travel to affected countries within the preceding 21 days.
We're out of time now, Dr. Wright, but in 10 seconds, how equipped are we as a country to handle any Ebola case right now? 10 seconds.
10 seconds. We are doing what we can in terms of standard precautions for infection prevention and control, which is our most basic structure that we have in place.